Hello, my name is Florin Gandor and I'm an Associate Professor of Neurology at Macquarie University in Sydney. Today I want to talk to you about a clinical clue concerning the voice of MSA patients. MSA patients have a very characteristic voice pattern that makes them distinguishable from other movement disorders. In MSA patients, you will be able to hear a usually strained voice with an increased pitch, which means the voice is higher than usual. Therefore, the voice is referred to as a high-pitched voice. This high pitch comes along with a reduced pitch variation. And the pitch variation is something that makes voice in healthy people melodic. In MSA patients, in addition to this strained and high-pitched voice, the voice will infrequently break and has sudden, brief changes of the pitch, either upwards or downwards. Another very typical feature concerning the voice in MSA patients that I have observed is a festination of speech, which means that patients sometimes very briefly get stuck on a syllable or a word. And I will try to mimic those two features by reading you the first two sentences of the Rainbow Passage in a way that I have experienced it from patients with MSA. When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. The question is, why is the pitch so high in patients with multiple system atrophy? Well, it's a result of a chronically dystonically innervated larynx and the laryngeal muscles. And on top of that, and similar to those irregular movements that we see in the fingers and hands of MSA patients when performing positioning tasks, those myoclonic jerks also affect the laryngeal structures, and that contributes to the sudden changes in pitch of the usually too high-pitched voice in multiple system atrophy patients. I hope this clinical clue helps you in identifying patients with multiple system atrophy in your daily clinical practice.